Welcome to We Are North Texas, a podcast produced by the University of North Texas system that shines the light on good work and good deeds by extraordinary people from the UNT system and its member institutions, the University of North Texas, UNT Dallas, and the University of North Texas Health Science Center. As the only university system based in and completely dedicated to the Dallas-Fort Worth region, we are North Texas. I'm Paul Corliss, Chief Communications Officer for the UNT system, and with me today are Dr. Jeff Beeson, Vice President, Academic Partnerships and Initiatives for the UNT Health Science Center, and Jessica Rangel, Vice Provost for Academic Innovation at HSC. Jeff and Jessica, how are you holding up during these unique times that we're living in?
I think we're doing pretty good. I think overall that we all are concerned and have a lot of compassion for those who are suffering right now and are scared, but that's what we're here for, to help support each other and help support our community in that.
Dr. Beeson, you're a Fort Worth native. How's the community doing? How's the community holding up?
Well, I'm more connected with the emergency medical community, and so we've been through H1N1 and Ebola, and now this is our third event. So we've taken the lessons learned, trying to work collaboratively, not make the same old mistakes, make new mistakes. But we're getting through it. I think a lot of people are worried and stressed, but times like these are when families come together, and we are definitely a family in the emergency medical public safety world.
Well, it really feels like HSC under Dr. Williams' leadership has kind of stepped forward and really been from the medical community to the community at large to help educate the public on coronavirus. How have you guys supported that effort?
So I think from our perspective, both Jessica and I have been in this community for quite some time, and are still very connected to the city services, hospital, healthcare systems. And so when this started to pick up, I think we were early involved due to our previous experiences and previous events that we've been through. So those still at the healthcare systems and the fire and police and EMS, where I formerly was the director of, they reached out early, and we just started collaborating and helping both on a local and on a national level as we prepared and started to see trends of exposures and isolations, people being put on self-quarantine, and we knew it would come here eventually, so we tried to take all the lessons learned from across the country by our other colleagues, and try not to recreate the wheel as we move forward.
Absolutely. Well, the topic I wanted to get into with you guys today, again, as we try to spotlight really amazing work being done by those that are part of our UNT system, is the testing center that I believe opened about a week ago on March 23rd. And this testing center, as I understand it, is on site at HSC, and it is a drive-through testing center for first responders. Is that correct?
That is correct. That is correct. In fact, the heart and soul of this was looking at an opportunity to support the infrastructure of our community in all of Tarrant County. And that means our first responders, the firefighters, the police officers, and we've expanded our scope a bit to include frontline healthcare providers. So, and again, it's just to keep the infrastructure in place so they can get back to work once they're cleared and give them peace of mind.
I think we were in a unique position. The limitation has been locally the testing capabilities and the reagents and other things to perform the tests. And so the Health Science Center has about a year ago started a strategic partnership with Quest Diagnostics. And so the President Williams reached out to the leadership at Quest, and we were able to get both test kits and our relationship allowed us to get some tests expedited through. And so that's why we really focused on our public safety, fire, police, and EMS, those who have been exposed to known COVID cases, who were either on home quarantine or starting to have some symptoms of illness, And so we were able to stand up in very short time a testing center, once again, from lessons learned previously, and working collaboratively with Quest, our partnerships with the city of Fort Worth and the fire department, Chief Davis and President Williams, and we're able to pretty quick.
When you say pretty quick, what do you mean? What day was this an idea in somebody's head, and was it a single person's idea? And then from idea to launch, what was that timetable?
So I don't know that anything happens with one single person. I think there were probably multiple conversations going on for about a week. I was kind of brought into it last Saturday. So, and Jessica, I think, was a few days before that. So Saturdays when I kind of came in and we walked to the location where we were testing, and then, started planning, getting everything together. And then Monday morning, Health Science Center, Quest Diagnostics, we were all here and seeing our patients on Monday morning, or our partners, are not patients, our partners Monday morning to start testing.
Mm-hmm.
So what are the operating hours and days? Is this just a weekday thing, 9 to 5, or what does the operation of the center look like?
So the Emergency Operations Center with Fort Worth Fire Department, they are screening all of the callers. So the healthcare workers, fire, police, and EMS, others, they go through the Emergency Operations Center. Once they identify an individual that needs to be tested, they refer it over to us. And then we get them scheduled. They are answering phones from 8 to 5, Monday through Friday there. We are here between 8 and 5, but due to the limitation and the number of personal protective equipment, we have strategically kind of grouped all of our test patients for the day into a small time frame so that we can use less PPE. When we started, we had more time, but we would test a few and either leave an individual in PPE for hours or take them out and then have to put another person in PPE, very similar to the hazardous materials world. So we have now grouped our patients into large groups, anywhere from 15 to 20 at a time, where we can put one person in personal protective equipment, drive through test a mass of patients, and then, especially like we saw last week with the heat, get that tester out of PPE before they get overheated.
Sure. What and how many people are being tested on the average daily, or how many people have been tested overall in your center?
Well, so far we've tested 96, and that was Friday, but we anticipate that number to ramp up since we have broadened the scope of the folks that we're willing to move forward with and swab. So we'll see what this week holds for us, but I do know our phone lines have been very busy this morning, so we know more are coming.
Broad question for you both. I know that testing kits have been in shortage and PPE have been in shortage, right? How are those shortages coming along? Are we getting to a point where we have normal supplies or not quite there yet?
So Quest has been very supportive with the test kits. We have plenty of test kits. The challenge becomes the machines that can run the test. I know that there's more, you're seeing a lot of media about instant kits, self kits, right, but it really becomes the volume. We've been told that we have other folks in town that have machines that can test faster, but they either don't have the test kit, so they have a very limited number of reagents. So from my understanding right now, Quest here in our area has the ability to test 25 or 30,000 a day, but it becomes the reagent that is needed in the machines, and I don't know the answers to that. I just know that Quest has been very supportive with us. Yep. And normally a 3 to 5 day turnaround, we've been able to work with them, and they've expedited our tests, and we've been getting results back in less than 48 hours.
Oh, wow. That's great. Have the people on, well, let me backtrack. Who are the people conducting the tests? Are they people that work for HSC? Are they people that work for Quest? Who's actually conducting the tests?
So by conducting the test, I presume you mean who's actually getting the specimen swabbing?
Yes.
Is that what you're asking? Oh, okay, great. It's actually our HSC faculty and staff that are doing that. But the really special part of this whole process is that we have students here who are truly doing the operations piece. They're vetting the cars through, they're checking them in, they're giving people instructions, and they're actually functioning in a safety role that we retrain every day, where they watch to make sure that as a student enters a cold zone, to hand off to one of the individuals in the warm or hot zone, which are the areas that are coming closer to where an individual would actually be that needs swabbing. But we have a safety officer that oversees that whole piece to assure that there's no contamination and that everybody stays safe. It's a pretty incredible role and a great learning experience for our students during this time. And I just think everybody should be immensely proud at how the students are performing, and just with absolute professionalism and really learning how to do it before they even come on this campus. So that's a big deal.
Yeah, I think so. My background in emergency management response, fortunately, many of our students have been removed from clinical rotations by healthcare systems. They just don't want students in the hospitals and clinics right now, plus the limitation of PPE. And so we have, our medical students, we've had our biomedical sciences, our physicians assistant students, and we've really taken them in and taught them just-in-time training, really, about incident management, incident command, and we've had a student leader who's kind of running everything from logistics, operations, and it's really, to me, a good thing to teach our students, because regardless of what specialty they go into, there will be days that they get placed in disastrous times, and understanding how the state responses from emergency operations and incident command structure, and then what happens on a federal level. It really, I think, unfortunately, it's a horrible time we're going through during the pandemic, but it's also a great time to teach our students.
Right, absolutely. Learning during a crisis is a special kind of learning. I was curious, have you guys noticed a high level of anxiety by students that are involved? It would seem to me that you might be a little nervous getting involved in a testing program for a virus that's kind of changing history as we see it here in the U.S. And I would be a little nervous if I were a medical student, helping out with this program.
Well, I think cautious is probably a better word.
Okay.
Because truly, knowledge is power in this process. Understanding modes of transmission and how to avoid that, knowing that somebody's overseeing you, assuring you that you're doing the right thing. We've not encountered anybody who's stressed about it.
I think through the entire episode, not just here, but across the globe, really, we've known about transmission of diseases and illnesses and good hand washing. And if you're sick, stay home and stay away from people. In personal protective equipment, the reason we have them and wear them in the various levels of, from the very basic to the most advanced. And so really, it's just an opportunity to reinforce that this is really what we should be doing every day. In maintaining calmness, it is easy to get worried and concerned when all you see is horrible news coming across, the internet and podcasts and everything. But that's not the majority. That's really the small amount of very, very small percentages of patients truly get sick. Those that do get very, very sick. But right. I think when you take it into context and really prepare people, this is the medical field we've chosen to go into. And you will take care of highly contagious, very sick people in your careers. Maybe you're going to see more now than you would see on an everyday encounter and every day at work. But this is kind of what we signed up for. So I also think that the students learn from the faculty that are here. And so, we've got, ex-military faculty and faculty that have been very specialized in surgical procedures and personal protective equipment. And so when they see calm faculty that when things even here don't go as planned, and they see that, then they're able to emulate that and carry on the great things that they have seen, and hopefully will then teach another one day.
Absolutely. Well, understanding that the testing center, it's a medical test procedure, I was also curious if those that are on the front lines interacting with the first responders that are being tested, has anybody noticed their morale? Are they holding up okay in the face of this pandemic? Because they are on the front lines in many cases. You mentioned you're also going to open the testing center to medical folks that are on the front lines as well. Is there a morale concern there?
I wouldn't say there's a morale concern. I think the bottom line is we still need each other. And I think when they come here, they feel the support from the very beginning to the point of where we actually obtain the specimens. So there's this ongoing support. I know that when we do callbacks with test results, there's lots of support there. That's what people need right now. It's really the blessing of the human experience that when they're armed with facts and compassion, frankly, that I think it makes a tremendous difference in their resiliency and being able to handle this. It's scary. It's a scary time for a lot of these first responders, because the big question is, if I'm positive, what happens when I go home? What happens to my family? Right. And nobody has a perfect answer for that, but we can help them work through that.
I think you see the medical, like the firefighters or EMTs and paramedics, they have a little more medical knowledge and understanding. I think the police officers who aren't medically trained, who are having symptoms, there is worry. And when they have a colleague who has been tested positive and now they're coming in, you do see a difference in the worry or concern based upon the specialty or what their profession is. So it's been a good time. I spent a lot of time on phones talking to people, like Jessica said. What does this mean? And there is no right perfect answer, more than the fact of just comforting and letting them know that there's always somebody at the other end of the phone when you don't know what to do. I mean, we're healthcare professionals and we phone our friends all the time.
Mm-hmm.
How long do you anticipate the testing center being open? I realize that's a tough question to answer because the circumstances on this pandemic change every day, but do you have any guesses?
So I'm not sure. It depends on the other tests. Quest Diagnostics has a new partner that's coming online, and this week will be ramping up their production of home kits, so that I, as a physician, can order this test to you. It'll be overnight to your house. You can swab yourself and put it back in an overnight and ship it back out. So I think when the testing styles change, right now we have a sample kit that has to be put in a specific medium and has to be kept a specific temperature. And so I think as the true scientists develop new ways of testing, that I think sites like this will be less important and you'll be able to do more stuff at home. When that will happen, I don't know the answer. A week, 2 weeks, a month, who knows?
That makes sense. Personally, as somebody that works for the University of North Texas system and is affiliated with your institution, the testing center is something I'm proud of, and I've seen features on the news and in the newspaper, and I know we've shared news about the testing center with legislators in Texas. It's big stuff, and it's powerful to see you guys making this difference. Do you feel personally? Do you guys feel a sense of pride in doing this work?
Well, I'm proud that I belong to an organization that supports and cares about their community. Let me just say that. I think this is what we were designed to do. And so it feels like just a sense of purpose in that this is what we're supposed to be doing. This is what we've trained for. This is what we know how to do. Like Dr. Beeson, I've been through the Ebola crisis as a patient safety officer during that time. And we pulled out lessons learned from that event. And I just feel like the culmination of all of our past experiences have helped make this happen. And it just feels like what we're supposed to do. So I guess to answer your question in short is, sure, absolutely. Proud to be a part of this organization.
Yeah, I'm a disaster guy. So anytime something goes wrong, it's what I've been trained to do. I'm just glad that, being in an academic center where we've got to have committees and make decisions, and in times of disaster, the committees are gone. We get to make decisions and implement things very rapidly. So I'm at home. This is, comfort to me. Plus the fact that the students are here. This is really, they'll remember this, and once upon a time, whenever the next thing happens, be it a hurricane or some other infection, they will have seen processes, and they are learning efficiencies and how to streamline and improve processes on the fly, and just a constant quality improvement process that goes well beyond the clinical aspects of medicine and more about the delivery of care and the humanistic things that we do as you mentioned, we see people that are concerned and scared, and so to me that's it. It
makes it, and it'll create for better healthcare professionals in the long run, right?
Absolutely.
Well, I appreciate both of you being so humble. We're very proud of what HSC is doing, not just with this initiative, but with others. I had just a kind of a personal question for each of you as we close out the conversation today. I know you're both very busy and have to get back to work. I'll start with Jessica. You've been in the healthcare business for 30 plus years. I'm sure you've seen a lot of things, but have you ever seen anything like this pandemic?
Well, elements of it, yes. During Ebola, that was a very big deal for us, even though it was a very short period of time. I have to tell you, that experience prepared me for this. Have I ever seen anything like this? Absolutely not. But I wouldn't trade this right now, this experience for me right now, for the world. I hate that it's happened. But so much good is going to, despite it's very painful, and I get that, but it's been an interesting journey, and I'm in it for the ride. So
I appreciate that perspective. It makes a lot of sense. Sometimes you think of the inconveniences that you're experiencing, and you lose sight of the big picture. So thank you for that. And Dr. Beeson, I wanted to close with a question for you, because doing a little research on your background, you've got some really deep ties to the institution. You kind of grew up at UNT Health Science Center. Your dad was the police chief for 20 plus years. I think you said 23 years. And you have a degree. You're an alum from the Texas College of Osteopathic Medicine. It's also the time that UNT HSC was going to be celebrating a 50-year anniversary as well. And in some ways, maybe it's a bummer that the celebration gets messed up, but at the other side, you're doing such important work, which is why HSC exists. Can you just talk about your connection to the institution and what this feels like?
Well, you're right. This is like a family. I mean, I was very young when my dad started, and got to see the institution grow through the years. Worked for the Health Science Center when I was in high school, and obviously coming back as a student at the Osteopathic Medical School. The Health Science Center has been involved in, through the last 40 plus years I can remember of lots of big events in North Texas. The Tarrant County Medical Examiner's Office was right there on campus, and so I know that in multiple large plane crashes that happened at DFW Airport, the Health Science Center played part of that. You think of the event and the Branch Davidians and the things that happened back then. The Health Science Center and faculty, our pathology faculty who work with the medical examiner's office. The law enforcement partnerships, even back in Ebola, the Health Science Center worked collaboratively with the fire department and police department on developing response techniques and personal protective equipment to primary care clinics. So yeah, it's exciting. And the Health Science Center will continue to be part of this community, and in what the city is and what the city becomes. The Health Science Center will be there and continue to prepare the providers of the future and show them that there's much more to practicing medicine than the clinical aspects. There's the being part of the community and making obviously the community improving health in the communities. That's kind of what we're here for. And so it's exciting. This is one of many events through the years, and I'm sure there will be more. It's been fun to be here and be part of this.
So far, we've been very proud of how the institution has stepped up. As those of us that follow Dr. Taylor, your provost, on social media, he often uses the hashtag HSC Proud, and you guys are certainly making us proud. So with that, we'll let you get back to the testing center. We know there's lots of work to be done here on the front lines as we combat this pandemic and work to keep Fort Worth and DFW as a whole and Texas safe. So thank you so much for joining me today. For those of you listening along, we have many more stories coming in the future. Thank you for listening to the We Are North Texas podcast, and we'll talk to you very soon. UNT World is a special place filled with talented and dedicated students, faculty, and staff that do amazing things every day. With our heart in North Texas, we transform lives and create economic opportunity through education. We are North Texas. I'm Paul Corliss. Talk to you soon.